Hi folks, tonight we're going to talk about dental hygiene. You've got good bacteria in your mouth and you also have bad bacteria. The good bacteria in your mouth help digestion and the bad bacteria, there's many of them, but they're known collectively as dental caries or tooth decay. Now, what happens with tooth decay? Well, what it is it's a bacteria that attaches itself to the surface of the tooth, and as the day progresses, every time you eat or drink sugary foods or sugary liquids, you're basically washing the teeth. You're washing your teeth, and what it's doing is it's feeding those bacteria, and those bacteria, they start to multiply. They start producing a little sticky substance known as tartar. What happens with that tartar is if you're not brushing or flossing properly or enough times, what it happens is it turns into a real hard concrete known as plaque. Now, this plaque has two purposes. The first purpose is to protect the dental caries, to protect the bacteria so that they can continue to live and multiply and thrive on the surface of the tooth. The other purpose is for the plaque to start pushing down against the gum. And by wedging itself between the tooth and the gum, it exposes more and more of the tooth surface so that more and more tooth decay can set in. Now, regardless of how much brushing and how much flossing or how much Listerine you're taking, it's not going to remove that plaque. So eventually, no matter what kind of dental routine that you have, eventually at some stage, when you go to brush your teeth, you're going to see flecks of blood or blood in your spit. And that's an early warning sign. And that sign is basically saying, go see a hygienist because your gums are losing. Okay? And the second thing you should realize is that this stage is known as gingivitis. It's an inflammation of the gums. The gums are reacting to the plaque. Now, if you ignore the signal, what will happen is that plaque will continue to invade further and further down into the tooth, pushing more and more against the gums. The gums will continue to fight that invasion, but it's a losing battle. Furthermore, you'll start experiencing pains, and your brain is going to start registering there's a lot of pain going on in your gums, and it'll start producing hormones, and those hormones will it'll start sending messages to different parts of the body to start repelling the enemy. Now, unfortunately, the body has nothing really strong enough that can fight that can remove plaque. No, I don't think there's anything natural that can remove plaque. So the only way you can remove the plaque is to literally go to see a hygienist and have it scraped off. And by doing so, what you're doing is you're allowing the gums to regain their strength and to come back and grow and reinforce the tooth. However, what happens if you don't bother? Okay, well, what happens is you'll continue to start receiving those pains. Your body is going to continue fighting a losing battle, which is not good in terms of hormones. Furthermore, when you do eventually present yourself to a dentist or hygienist with a nasty pain in your gum, they're going to look in they're going to look in there, and they're going to realize, oh, you're going to need a filling here, a filling there, a filling here, and that particular tooth needs root canal therapy. And you're going to have to suck it up and take it. You're going to have to pay €90 for every single one of those fillings that needs to be done. You're going to have to spend upwards of between €1,000 and €1,300 for root canal therapy. Okay, so that's a really nasty way to go about it. So what can you be doing? Well, firstly, plenty of flossing, plenty of brushing of the teeth, and a little bit of Listerine. Okay, by brushing your teeth, for 3.5 minutes or so, what you're doing is the paste is rubbing against the tooth, and it's creating an acidic environment, and tooth decay does not like acidic environments. So if you're brushing your teeth for 3 minutes, what you're doing is your mouth becomes more acidic, and it starts killing off a lot of the bacteria that's residing inside in your mouth. So by doing so, you're actually slowing the process down. Again, flossing in between the teeth as well. It's very important to get into those crevices, because that's where the dental caries can do its worst. And it's particularly difficult for a dentist, especially if you present with a pain in your mouth. It's most likely down to a bit of rot that's between the teeth, and you can only imagine just how difficult it is to treat something like that. So a good flossing routine, and a little bit of Listerine as well, just to wash the mouth out and to get into all the places that the brushing and the flossing hasn't. Furthermore, you could also think about getting a dental insurance plan. So we'll discuss that next week. Okay, take care.